In your genetic counseling appointment, your genetic counselor will ask about your personal and family history to help you understand your risk for cancer and whether or not genetic testing would benefit you. There might be steps you can take to reduce your risk or find a cancer early. These steps could change or happen more often if your cancer risk is high. There are many factors that influence your cancer risk. One factor is having family members with cancer. Gathering information about the health of your family members before your appointment can help your genetic counselor. You might not be able to talk to family members for many reasons. Maybe you're adopted and you don't know your biological family members. This is all very normal, and your genetic counselor will understand and still want to talk to you. Gathering medical history from your family members can be hard. Talking about cancer can bring up a lot of emotions for everyone. A couple of ways to talk to your family about their medical history are: tell them why you want to know. Say, I'm trying to find out if I have a higher risk for cancer. Ask the family member who seems to remember and know the most about the family historian. Ask about the good family memories as well. The conversation doesn't have to only be about cancer. It can be an opportunity to learn more about your family. Your genetic counselor will review your family's medical history to find clues that can be used to estimate your cancer risks and maybe those of your relatives. These clues are genetic test results, the age your relatives were when they were diagnosed with cancer, where the cancer started, and if a family member had 2 separate cancers. If your family members have had genetic testing, then their genetic test results can be helpful to your genetic counselor. You can ask your family member about genetic testing and see if they are comfortable giving you their results. Your genetic counselor might be able to help you ask if they were tested at the same clinic. One of the clues is the age your family members were when they were diagnosed with cancer. Cancer tends to happen in people when they are older. So if someone has cancer at a younger age, that is a clue. Another clue is where the cancer started in the body. The more exact the location is, the better. Some areas of the body, like the middle, have many different parts. For example, a family member might say they had a female cancer. However, it would be more helpful to know if the cancer was uterine, ovarian, or cervical. Each cancer has different cancer risks for their relatives. There can be confusion about where the cancer started. Sometimes cancer starts in one body part, then spreads to another. The body part the cancer started in gives the best information. For example, a relative may have breast cancer, which spreads to their bones. It is important to know it started as breast cancer, even if the cancer in their bones was harder for them. Another clue is if a family member developed 2 separate cancers. This is different than one cancer spreading or a cancer coming back. For example, if a family member had breast cancer, that breast cancer can come back or spread to other areas. But they can also develop a new cancer, like a new breast cancer, on the other side. In summary, talking to your relatives about cancer in your family can help your genetic counselor figure out your risk for cancer. The clues your genetic counselor is looking for are genetic test results, the age your relatives were when they were diagnosed with cancer, where the cancer started, and if a family member had 2 separate cancers. If you can't talk to your family members or you couldn't get all the information, that's okay. You should still talk to your genetic counselor. They will still be able to talk to you about your cancer risks and some steps you can take to reduce your risk or catch a cancer early. They will also discuss whether having genetic testing would help understand your risk. If so, the genetic counselor will help order it for you and explain the results. If you have any questions, please bring them to your genetic counseling appointment, and your genetic counselor will be happy to talk to you about them.